Welcome back to Stay Tuned, Supporting Transition Age Youth. This podcast is brought to you by the Transitions to Adulthood Center for Research at UMass Medical School, Department of Psychiatry, and in partnership with our research sponsor, the National Institute for Disability, Independent Living, and Rehabilitation Research. I'm your co-host, Emily.
And I'm your co-host, May.
And this is part 2 to Scott's episode. If you haven't seen part 1, go ahead and listen to that first. But why don't we go ahead and get into it? And Scott, you can start telling us about the Children's Mental Health Network.
Well, great question. And need to back up a little bit to answer it, to give it context. So the Children's Mental Health Network, the precursor to the network, was a group called the Alumni Network. So I had mentioned that I've been involved in doing community assessments around the country, but they were for this comprehensive system of care program that was in legislation and offered the opportunity for states and local entities to have 4- and 6-year grants to basically, it was to experiment with this notion of systems of care, which was really the predominant model that through the federal government was being employed at the time for many years. And so I was part of that effort in a lot of different ways. But what would happen would be that, so you would get a 4-year grant or a 6-year grant. Well, the question that would come up is, what happens after the 6 years are over? It's a very important question because the federal government has put all this money into testing out this notion of looking differently at partner relationships, how money is spent, and on and on and on. And then the grant's over. What happens? Well, for a lot of communities, business went back to the way it was before the grant. And so you had grantees saying, man, is there a way that we can keep this going, keep the excitement, keep the momentum going? So the original, I laugh about this, and the original kernel of a collective group was an email list. And I'm not sure I have the order right, but there were 2 people who had this email list that kind of oversaw it. Neil Horan from Georgetown University, when they had the training contract for the system of care grants, he was the keeper of the email list. And then when AIR, it's another group, had the contract, Emmett Dennis, both great guys, wonderful, known them forever. But it was an email list. And it's like, okay, so we got an email list of all these past grantees. And then I got involved, and it was like, okay, let's have Scott take this email list and see if we can make something. And so we wanted to create this thing called the Alumni Network. And basically, quite simply, it was an opportunity for grantees who had graduated to stay in touch, get together to talk about system of care stuff. And so we started doing that. We got a small, so we're not a formed 501c3. We're not in anything like that. It's just this thing called the Alumni Network for Systems of Care, and got a research contract to take a look at the effectiveness. And we were looking at a lot of different things like websites and what kind of information you send out. So I was heading up that, but I started to just be really bothered, because if I have a contract with you and you're my funder, then you're going to want certain things. They're not bad things, but you're going to want certain things. And I am an obstinate individual. If you say blue, I'll say yellow, and just to shake it up, and I found myself thinking, along with a few others, if we're really going to make this work, if we really want this to be an independent voice, because that was the idea, you have people who have expertise, but if they can be an independent voice, that can really help the field, right? That's great. The only problem is that most of the ideas generated about what this could be relied on, I'll call it old world models, the models that rule the day. Like, hey, become a TA center, get $1 million contract and and be able to employ lots of people and do great things. That's a model, and it's a model that has worked very well. But for me, and I think for my history, my developmental process of the kinds of things I talked about earlier, I just thought that if I couldn't be part of something that was going to prescribe, that was going to say to you, this is the way to do it, right? Because in my mind, there's lots of ways to do it, whatever the it is. So I couldn't wrap my head, I have so many colleagues who I love so much who were so frustrated with me. I mean, just so like, dude, what are you doing? You could you could get any training contract we want. We've got all this expertise. Yes. Um, you know, we need members. We need to make this a membership organization where people can opt in. But you got to remember, my whole life I've been an outsider, and this idea of the club and then the people who are not in the club, you know, nothing pisses me off more, than if I'm in a situation where there's the inners and the outers. It's and I struggled with it. I struggled with, but there were a few people, Pat Baker, Cindy Nation, who eventually became on the board, and I mean a very small few people. And I know I'm going to leave people out, so I'm not going to try to name all the people who were involved. Just those two, only just to give us a frame of reference. There were a few people who got it, or at least understood what I was saying, and it's like, so we were at a meeting in Atlanta, I think it was a McCare meeting, and we're in this room full of alumni, people who are about to be alumni, and everybody's excited because you're thinking, oh man, this is great. We can all become consultants. We can do this. And I stand up in the front of the room and I say, basically, okay, here's the idea. We don't take any federal money, not a dime. And it's like you could hear a pin drop. What the bleep? It's like, what do you mean? No, we're not going to take any federal money, not one dime. Why not? Because if we take money from anybody, we're owned by them. Now, I want to be real clear. There is phenomenal value in taking federal money. I'm very, very clear of that. And there's lots of amazing groups that do that. For me, it was like, we have that. Okay, we have those groups. What don't we have? We don't have that truly independent voice who can call us out on something and not suffer financial repercussions. And this is a real delicate subject, guys, because it's like um, and I was not always good, because I tended to be blunt, and I was not always good at explaining it, because it wasn't that an entity that takes federal money is bad. Not that at all. It's just that there were already bunches of those. Why would I want to? And in fact, some of them were very suspect that I was trying to start another entity like that was going to compete with them. So then you get into this ridiculous kind of subterfuge fighting. What the hell is Scott doing? What's he trying to do? Is he trying to take our contract? And I wasn't. And people realized that eventually. It probably took a good 2 years for people to, but guys, that's the way of the world. That's a dynamic that's going to exist for you when you're running the show, in terms of in this world. That doesn't change. So you just need to be clear. I needed to be clear. So we stand up in this meeting and say, okay, we're not going to take any federal money. We're not going to create a team of consultants that we shop out, But for me, it was real simple. The only money we're going to take is donors. If you want to give us money to help us keep the lights on, awesome. But guess what? No strings attached. Well, we didn't get any money. I didn't care. It was like, if this is what we're going to be, this is what we're going to be. We want to be an independent voice. And it wasn't because a lot of the talk at that time was around, what are they trying to do? Are they going to go after SAMHSA? Are they going to go after this group? It wasn't about going after anybody. It was just, wouldn't it be sweet if there was an arena, a forum that truly wasn't beholden to anybody? And that's so at that meeting in Atlanta, where 90% of the room left, it's like, okay, well, knock yourself out. See you later, cowboy. It's and of course I loved it, because it was an opportunity to establish clarity early on that no, we're real clear about what this is and what it is not. Was it the right move financially? Absolutely not. Was it a move that a business course would call a perfect model? Not in the least. What are you doing? But I've always been able to make something work on a shoestring budget. So, and that's the other thing. We peeled away all the mystique about what's needed or not needed. What we had, and I will always be grateful, is that even though people weren't necessarily willing to jump on board in terms of the structure of it, because we weren't going to take money, we had access to the brightest minds in the field. And I think when people saw that we weren't out, some of the early weird stuff of people thinking we were out to get people or to take away contracts, when people saw that that was not the case, and that happened pretty quickly, I'm just smiling. I only had one group that was really pretty difficult, but it doesn't matter. But when people saw that, then they embraced it, and it was pretty darn cool. It was like, oh my God, yeah, this is great. So independent voice was key. Breaking away from SAMHSA was key. And when I say breaking away, not in opposition, but just breaking away in terms of I don't want anybody telling us what to do. We became incorporated, became a 501c3. And so obviously our model was different. We didn't have staff. I didn't pay myself a salary. It was just like whatever comes in, let's, keep this going. In effect, we became an outsider, but with lots of friends on the inside. and it still did some work with the inside as well. So yeah, being an outsider and being okay with it. And in terms of impact, so that's the whole structural piece, which is critical for me. And it's critical for the decisions I made and the board made when we closed the network down. And we'll get to that, I'm sure, later. But the impact, the word impact is pretty subjective, right? What do we mean impact? We did, there were so many things that I'm very, very proud of. I think the one example that I like to use, well, let me say first, we did get involved in holding conversations. So the 21st Century Cures Act, there's a portion of that, the mental health portion, that basically was lifted out of legislation that was spearheaded by a Congressman Murphy. And this is years before. And there was a lot of very passionate and heated dialogue about, especially about something called assisted outpatient treatment, which was, now this is before, and this is not a political discourse, but you see where we're at now in terms of nobody can get in the same room together. This was right on the cusp of that. We saw the beginnings of it, but we would go to Washington, D.C., and I would have people on their own dime who were part of the network come and join in DC. We had Youth Voice, Martin Rafferty from Youth Era. We had Family Voice. We had providers. We had researchers. It was a nice group to talk about assisted outpatient treatment. And we had a meeting with Congressman Murphy's office. And I just remember thinking to myself, God, there's got to be a way we can get the two different sides talking about it. And what was really challenging at the time is we had advocacy groups fighting each other for and against. And that's just the kiss of death when you're trying to pass legislation. So my idea was, and this is about just enthusiasm. I said, hey, got a great idea. We want to have a meeting not with you, because you couldn't get these congressional people to sit in the same room, because press would be there. Don't want you. No, we don't want you involved. We want to have a meeting, no press, with your staffers. So you have staffers from the side that agree with the AOT argument, which was a big argument at the time, and those that disagree. And better than that, they don't have to do anything but come to this meeting and listen. There's that listening again. So we're not, you don't have to go on the record as making a statement. You go on the record saying I this, which is what would freak them out. I said, so we don't want you, we want your staffers, and we just want them to listen in the hopes that it can broaden their understanding of the issues involved with this very controversial topic. And daggone it if they didn't say yes. So we had this hard but beautiful meeting. We were in well, we were in the whip's office, I think. The house was, I can't remember. Beautiful conference table and all this stuff. And sitting around the conference table were the people that I asked to come. And with that group of people, you had advocacy groups that were very supportive, and then advocacy groups that were totally against it. I mean, with all their, as advocates are, right? With all their heart and soul, passionately. And I facilitated a dialogue with these groups. Sitting around the table, around the outside, were these staffers from congressional offices. And it was novel and it was different. None of them had ever done anything like it. Did we change minds? I probably not, but it was an attempt to just change the set a little bit, by taking them off the hook about having to say, I'm for this or I'm against this. I say, you don't have to say anything. I just want you to listen, just hear. And they got to hear the people who were in their corner who fed them information for what language should go in a bill and vice versa. I was so proud of that. I was proud of the advocates who came because it was hard. It's hard to listen to somebody who you're vehemently opposed to. That stuff's hard. And I see what's going on now. And it's like, I don't know that meeting could take place today. It could take place in, what was it, 2017? I can't remember when it was, but it was getting difficult. But that was an example of the power of the network. No money. We weren't owned by anybody. And I got those questions from congressional staffers. Who funds you? Wanting to know, so all of that stuff was stripped clean. It made it something that we could definitely do. So that's a great example. But here's the negative about my approach to not taking money. That's expensive, and we couldn't keep it up. And so we stopped doing those meetings, unfortunately. But I say unfortunately, but I wasn't despondent enough to take money. So it was like, we'll just let go of that. Another example of impact, and is the most basic, simple, yet powerful example for me, is that when early on with the network, when I started sending out the newsletter. Oh, and the reason there's Friday Update news, the only reason that came to existence was I didn't have any way to tell if anybody was reading the doggone website. We had done this website. How are we going to know? Well, let's start sending an update. And I got an email from a teacher in Eastern Oregon, which, if you're familiar with Eastern Oregon, it's very deserty, kind of out in the middle of nowhere, just saying how valuable it was. And I can't even remember what the tool was, but often, like, so let's say your university was doing a research project and you had put together a manual, or you would put together a document that was paid for by the federal government. Again, here's the good news, right? And you had it available. So I put it in Friday Update. This teacher in Eastern Oregon, who hasn't a clue who you are or that you even exist, gets this thing and says, oh my God, this is exactly what we need. And I didn't have to pay for it. I didn't have to think that I had to be able to afford to buy it. Here it is. It's right here. And she was just so excited. And guys, that kind of dialogue. That's the thing I miss most. Has happened. I think I started writing Friday Update in 2000. It's happened throughout from people all over the world. It was, it's again that ethos of whatever good work is being done in as it started in these system of care communities, how can we spread that word? How can we just send it out? And it doesn't cost a freaking dime. Doesn't cost anything. And it can get people excited about doing something. It's just, yeah, I'm getting misty thinking about it because it really warms my heart. There's so many examples. There was a program in Scotland called the Daily Mile that was started by a principal trying to figure out how to help the kids with get their own mental health, and get them through the day. And it's just such a simple concept. And then it was picked up by a high school coach in the United States, and now he runs the Daily Mile and introducing the Daily Mile to people who read Friday Update. Suddenly, it spreads. It's just, I mean, it's just so beautiful to see, and I think again, all the times that I watched conversations with power players who kind of held things close to the vest in terms of what they did and what they produce. It's like there's got to be a way we can see. And of course, um, uh, organizations like yours, just because I know them so well, I mean, I think they always loved the fact that because we're spreading your information, if it's good information, if it fits, let's share it. So that's a long way of answering your question. I don't know if I answered your question. Who knows? Did I answer your question?
Yeah, no, that was great. Yeah, no, I think that was really
Oh,
great to
good.
hear about how you kind of, I liked what you were saying about, like, yes, of course, having funding and having these big organizations, that's really important. But
Yes.
there are other ways you can also do that, like
Yes.
outside of that.
Yeah. And it's just knowing, and for your audience, especially because, my journey is on this end of the spectrum. Your journey's over here. And to just know that there's always more than one way. Always. What does your heart tell you? What's that voice inside you saying? And then, okay, so how can you listen to that and make that come to life? There's always another way. And I think that the network showed that time and time again in a way that's loving, in a way that is not requiring a quid pro quo. Never, there never was a situation where we said, well, I'll post this for you if you'll do X for me. Never, never. And we got a lot of feedback on that, especially when we were closing down for people who of the things they admired. It was that. It was like there never was a hidden agenda. Yeah, and there isn't.
To your point about, just hearing the feedback from people on the newsletter itself. When we get emails from the podcast, people listening to the podcast asking about like, hey, I was listening to this episode and I was wondering how can I get involved in this one thing that you're talking about. It's always so cool to see that, oh, hey, we're actually kind of doing something here. Like our
Yes.
reach may not be that big, but even though it's gotten to like that one person, it's still something. It's still
Can I
impactful.
share something with you? I got to share this with you because it speaks to that point. So we we've had we've been so blessed and so honored to do work with some amazing people. So we were doing work with Sesame Street, and this is several years ago, and I was in a meeting with their leadership, and I said something like that. I said, we don't reach a lot of people. We just really don't reach a lot of people, and the person um, just stopped me cold and said, wait a minute, wait a minute. She said, it's not about how many, it's about who. And you think about that for a minute. And that completely changed the way I look at numbers with the network. Because before there was this push, you got to count everything, right? And so a lot of state organizations would send out Friday Update under their cover, which was totally fine with us. And so we'd be trying to count, okay, there's 700 there, there's 800 there, there's, 3,000 here, there's this, that, and the other. And it completely changed my thinking of it. It's not about how many. It could be 1,000,000, it could be 100. It's about who. And it was those who's who really began to reflect the pulse of the network. So we have who's in England, we have who's in Ireland, we have who's in New Zealand and Australia, and we have who's all over the place who spread that. And so I completely stopped worrying about that's probably all. Oh God, that's probably also terrible advice because you got to follow your metrics. I was like, I just am totally not worried about that or interested. And take it for what it's worth, guys. But it's like I lead with my heart, and it's just the universe will figure it out. What needs to be will be, and yeah, that'll go over real well in your next budgeting meeting. So I can't help you there. But it was it's along the lines of the advice I received from that professor who said, when I don't know, I'll tell you I don't know. It's not about how many, it's about who. And then that can change your whole thinking process about what it is you're trying to do. So you're not just chasing your tail, you know. Um, the world of influencers, which I know you guys understand probably so much better than I do, but it's an interesting concept to think about. It's like if I stop focusing on the N and start focusing, what who we really want to reach. I'll give you a great example. We had a young lady. She was, I want to say she was 17 at the time, and she had stereotypical movement disorder. And I didn't know her. It did this is what would happen. These people would, and she said, I would like to put a thing on your blog. I think she called it a blog. Maybe it was a blog at that time. And she wrote about her experience with it. Now, later on, and then a couple years later, she was applying to grad schools, I think. I can't remember. And she said, "Do you mind taking my name off?" And I said, "Absolutely." That's the other thing. It is completely driven by the people who's in, because she didn't want to be identified. I said, "That's fine." And I said, "But I just need you to know how many people you've touched." I can't tell you the letters I got, not letters, emails I got from parents, typically moms, who would say, "Oh my God, just knowing that there's another young person who has what my daughter has is like, you don't know how profound that is." And then they have the kids read it, the young adults read it. And it was just this, and there's part of me that would wanted to call the anonymous and say, "God, would you please just do another article?" But I didn't. Totally honored her wishes. But it's just an example. Another example is third culture kids. Dina Sishal, who is a writer, and is a third culture kid. That's basically an American who grows up in another country. Like if you're in the service or something, you grow up in Afghanistan, you grow up in, England or France or Germany or wherever. And she writes about the mental health challenges that those kids face when they come back to the States, just because everything's different. Culture's different, environment's different, but it's not something that a lot of people know about. That is the most popular post that we've ever had in Friday Update. And so when I said not about how many, about who, there's an example. And on third culture kids, because they're all living this, but it's not good. So just an example. But we would get those kinds of examples all the time. Every time that would happen, I would feel both honored and blessed that, it was an opportunity for little to no money to share a message in the wider universe that somehow finds its way to someone who doesn't know anything about SAMHSA, doesn't know anything about systems of care. Oh, and that's the other thing on the network. Very quickly, we grew out of SAMHSA. We originally we focused pretty much on, which made sense. But the more examples like this that I started seeing, it's like there's this whole world of opportunity. You don't have to be a SAMHSA grant to access it, and everybody can benefit. So it was kind of a natural progression into a larger picture.
We know that you had your own podcast called The Optimistic Advocate. And you've seen obviously a lot of shifts in the field during your time working and like your time with the Children's Mental Health Network. Um, so I was wondering if you could kind of share like your perspective on like, well, you kind of talked about how far the field has come, but how, like, what sort of issues do you think still need to be addressed? And specifically, like for our podcast, at least, what do you think are the most important topics to talk about in regards to young adults and like how we can continue to like change and improve the system for us as like the next generation of mental health workers, but also like for young adults who are listening and
Yeah.
these things are impacting them.
Well, as far as the system, the shifts in the field, it's kind of like a hamster wheel. I hate to break it to you guys, but because the similar issues that were front and center in 1983 are still there. And but I remember at that time. So, but that's not a fatalistic view. So if you think of it, it is kind of like a hamster because things change, things revolve. Before, it's so funny. People of my generation, a lot of my friends, we like to talk about how we were at the forefront of change, right? Whether it's with families as allies or wraparound services, the things that you hear about now, even youth voice, because it was tempting to take credit for that. And that we were at the forefront of change, and a change was made and it was adopted, and then all is well. Well, the world doesn't work that way. I mean, there were things that were happening, long before I got involved. In the 60s, I mentioned Bill Hollister, my one of my mentors, and the work they were doing. So if you think of it as like a hamster wheel, the wheel goes around and it comes back around, and here we are. But there's things that you learned or things that you got put in place that improved, but it does seem to be a continual cycle of the same kinds of things: family involvement, youth voice, um, and specifically for me, looking at grants, for example, that um, there was in the early days there was heavy emphasis on family involvement, and funding didn't match the level of importance associated with family involvement, cultural competence, which was the language of the day, and also youth voice in federal grants. Well, that kind of stuff waxes and wanes, and we saw that especially when the system of care grants moved away from local grants, where you could really get into a community and say, okay, let's see how this can work, to more statewide, well, things get watered down. Well, that's what I mean by watered down. Doesn't mean that they're not doing good work, but it's more generalized. And we continually fight that. We were fighting that in the 1980s, a generalized approach to mental health services, when that group of 6 parents stood up and said, yeah, but you're not addressing this, right? So there's this flurry of activity, this funding that goes to that. And then we've seen over the years, you talk to any family advocate who's been involved with this since the 80s, they will absolutely tell you that it feels like in many cases we're right back where we started. So you can be defeated about that, or you can say, okay, what's stuck? Let's get on that wheel again and figure it out. I think youth voice is more important than ever. But here's the thing. I was thinking about your question. It's time for you guys to take over. Um, don't wait for the old geezers, like this old geezer that's talking to you, to do it, or wait for this old geezer to give you the plan. This old geezer can be helpful, but the ownership, the taking the bull by the horns, I really think that needs to come from you and people like you. We are living in an age of social media and AI that is just exploding, right before our very eyes. I think it's very exciting. And for me, the modeling that I want to see done has to come from the people who know that world the best. And that's not me, that's you. That's you. And so my question to you is, okay, how do we not become consumed by it? How do we not run away from it? But how do we learn to capitalize and, to exist and to capitalize on what is happening, offering wraparound services in a community? That could be part of what's done, but I don't want to see you get stuck in that while this freight train is moving forward on AI and social connectedness and what that looks like. And even that's going to be outdated, before we know it. So you see what I'm saying? So I could say, I could tell you, I think it's important that you continue to promote systems of care. But I really, when I ask myself that, what does that even mean in this world post pandemic? Pandemic threw everything on its ear. The challenge you're going to have is that bucks up against the current power structures in terms of the way business is done. So this is not an easy thing, but the last thing I want to do is give you an answer that has you focusing on the minor when you got that freight train that's just barreling through. This is about you acknowledging your strength. That I'll make a generalized statement that I think you don't even realize you have. I don't think you do. And when you wake up to that, oh, look out.
Yeah.
It's right
Yeah,
there.
no, I mean, I think that is definitely like, yeah, I appreciate you saying that because I feel like it is something that our generation is kind of more aware of, but it's not always acknowledged by
Yeah.
other generations.
Yeah.
And I think it's, yeah, I feel like, I mean, yes, obviously it is scary in a lot of ways, but it's also empowering,
I remember when I was here in North Carolina working, and my boss at the time, a guy named Mike Owen, great guy, and he had this mindset of like, we're just going to do it. We're just going to do it. And we were like evangelists. We would go to any community that would listen to us, any school that would host us. And we had a suicide prevention curriculum we had written, and it was very popular in the day. And I mean, literally, if I could stick my foot in the door before you could slam it shut, that then we figured we had. I mean, it was hilarious. I look back and I laugh. Okay, so I tell you that world doesn't exist today. The world that exists is your world. I mean, it's my world too, but I'm a passenger on this. I'm just being dead flat honest with you. And I can give you my wisdom. So can all the people who your elders can give you wisdom. There is an absolute place for that. But the fundamental structure of the engine, the model that's going to drive you forward, that's got to come from you guys. So get busy.
We're busy.
Yeah, no, yeah, thank you for that. I think I appreciate that because it is, obviously your advice and your experiences are, of course, really valuable and important, but it is also like it is a different world, and there
It's
is
a
only
different
so much
world.
that we can do with that. And
Yeah.
it's good to acknowledge it and to be aware of it, but like it is, things are a lot different now.
And the thing for you guys to understand is, I'm saying this sounds pejorative, I don't mean it to be, but is that not to understand, pay attention to the reality of power structures and the way that works. And that doesn't mean you blow everything out of the water. You obviously have to learn to navigate. That's where the advice of elders can come in about navigating power structures. But you are at a power imbalance right now. And that is about to change, and it's already changing. And I just chuckle at some of my colleagues when I have this conversation. They roll their eyes and say, Jesus, Lord, what happened with you and your awakening? You've lost your mind. What are you talking about? Oh, no, I see it as clear as day. You are the future, not in a paternalistic way. That statement to young people is often made in a very paternalistic way. You are the future that I can't even fathom right now, but I know it's going to be amazing because when I was your age, we were the future. We were the ones that said, that's fine. With all respect, that's fine, but we're going to try it this way. Because if you don't, then you're going to be saddled with an antiquated model, in this case of mental health delivery, that even today is quickly not fitting with reality.
Yeah, I do see what you're saying, and okay, a bunch of things come to mind. Firstly, I think the way in which our system is set up to make changes, so like academia, for probably the most obvious one,
Yeah.
policy, all of those barriers that you'd have to go to school, you have to get your PhD so you can be a PI, so you can run your own study, which, you know, to your point, I think that's where the older generations can give us advice of how to best navigate to get into those positions where we can start making changes. Because the reality is the system is pretty set and it's going to take a lot to overhaul those. But then I think that's where like social media and tech comes into place, because we're already seeing people who don't necessarily have the academic requirements, right? But they still come up, they still have valid points to make. They still have lived expertise. So you can use social media as a platform to sort of deliver new ideas. And then that brings me to the way in which people are interacting with their world and what's the word? Like practicing social connectedness through these online communities and platforms.
Yeah.
It just looks a lot different than my parents' generation. And because like I was pretty much born into it, I think I have a hard time recognizing the differences exactly, and like noticing, oh, I guess like that is a way I connect socially to my world, is through this online mechanism, and I don't even fully realize how immersed me or my peers
Exactly.
are in it all. So
Exactly. And I am excited for that explosion of growth and recognition of your own power. Guess what? That already exists within you. It's already there. No, I'm telling you, you're wired. You're wired differently than I am. And that's a beautiful thing. And for me, it's like you're the one who's better prepared to lead us than me or people like me. And that's a hard thing for people to say. It's hard for people to wrap their heads because you spend your whole life building an identity, right? But do you see the power in being able to, for the older generation, to be able to let go of that a little bit and honor, totally honor what they have to offer, but totally embrace supporting not their version of what that younger generation needs to become, but supporting that younger generation to develop a version
Mhm.
or a reality of what they need to become.
Mhm.
Because guess what? It's going to happen anyway. So
Mhm.
my question to you is, do you want to be a part of it or do you want to just sit on the sidelines? Both are options.
Mhm.
But this world is going to change and it's going to, I mean, gosh, just with what's happening with AI now in terms of job replacements, and things like that. I mean, things are gonna happen in the next couple of years that none of us sitting here uh, can even imagine. But the one thing that I believe in with all my heart is that you two are going to be better equipped to deal with it than I am.
Hopefully.
Yeah. Yeah, no, I mean, yeah, like again, like it's really honestly refreshing to like hear you say that, because I do think that, for the most part, older generations, and I mean, it makes sense why, like I can understand why, but they do really have a hard time kind of stepping out of the way a little bit, like for us, and
Yeah,
saying, okay, like you guys are gonna figure it out and like do it in your
yeah,
own way. And like we can't predict that. Like May and I can't even predict that. Like we don't even know
right,
what's gonna happen.
right.
But it's
And we
like,
can be here to help you. We can be here to
yeah,
offer
exactly.
thoughts and guidance. But this is just such the critical part of all of this. It's your model. It's not my model for what I think would work best for you. It is
Yeah.
your model.
Mhm.
Yeah. I appreciate that. Thank you, Scott.
Yeah. Thank you. I think
And
it's
that leads me to, I think your last question, which was about the music.
Yeah, the
yes.
song recommendation for us.
Do you want to go there?
Sure. May, do you
First of
wanna?
all, I want to tell you why I did the music. So for your listeners, the Friday Update always had a song that started off. And I remember that when I first started doing that, I got some of the feedback I got from my contemporaries. Oh God, that is so hokey. what are you doing? You know,
I like
and
it. I think it's
yeah, and
fun.
for a lot of people, it remained hokey and remained to it. But the reason I start so Friday Update is a listing of great resources in mental health, some opinion pieces, be a variety of things. But that's all, head stuff, right? Up in the brain. I've just been a firm believer. Is like I want to figure out a way without hitting people over the head to help them break set, to just throw them a curveball to help them think. So starting with a song, and sometimes with some of the music, I would say, okay, you got to close your office door, and I want you to dance to this.
Mhm.
It's like, well, that's where I'd get the hokey comments. But for the people who embraced it, oh man, the feedback's always been wonderful.
Mhm.
And so I know you guys wanted to know a song suggestion, and I never know, excuse me, what the song is going to be until right before it goes out. It's whatever. Oh, excuse me. Sometimes there is a deliberate song choice based on an event that might have happened, but very often it's just how my brain works. And if I find I typically, a lot of times there's mainstream music, but oftentimes there's not, and music from different countries. It just whatever it is. But I thought about for this, since this interview was about sort of my journey with this, um, the song I chose for you is by Lucinda Williams called "Rock and Roll Heart." And there's a couple lyrics that in that I really like. One, follow that dream wherever it leads, outside of the outsiders. And that kind of frames what we've been talking about this whole morning. Follow
Yeah.
your dream outside of the outsider. And as long as you got a rock and roll heart, it can't be broken or torn apart.
Aw,
Rock and roll,
love it.
guys.
Rock and roll.
Thank you.
Well, thank you
Um,
so much, Scott. This was really fun, and it was really great to hear your story and your perspective on things. So thank you for joining us today.
If you would like to contact us, you can email us at staytuned@umassmed.edu and check out the Transitions ACR website at umassmed.edu/transitionsacr. Thanks for being here, and be sure to stay tuned for next time.